Right, well, it's 11:30. I hope everyone has had a chance to have a bathroom break, picked up a coffee, picked up their regular mince pie. It's been a busy morning. I've not had a chance to finish my 11 o'clock mince pie as yet, but I'll be nibbling along that as our key speaker that goes through the next session. We've had two fantastic keynote presentations so far, very different, but obviously complementary, all talking about how the ward round can be improved from an education point of view, but also from a patient perspective as well, and especially important to involve the patients in that improvement work. Our next keynote speaker, I've got to declare a conflict of interest, is a good friend of mine. Dr. Ruwani Abeyratne is a current geriatric trainee or geriatrician trainee in Derby Hospital, and very soon will be moving to a consultant as well. Ru has a vast experience in wellbeing and burnout. She supported Shared Voice Hospitals for a couple of years as a clinical lead in wellbeing, and has also worked as one of the clinical leads for the Midlands Charter, a wellbeing initiative looking at supporting over 8,000 medical trainees across the Midlands, which was a BMA award winner in the last year. Ru today is going to talk all about how to support the most important elements of our NHS, the workforce, and how to make sure that they remain the heart of the modern ward round and how we support them going forward. So Ru's presentation will take 35-40 odd minutes, and then will be an excellent opportunity to ask Ru and questions and discuss the presentation for. So Ru, I'll hand over to you. Fantastic to have you this morning. Thank you for joining us.
Thank you, Dan. So this is the most stressful bit for me, is sharing my screen. So I'll try and do that, but yeah, bear with me. So let me see. Can you see my presentation?
We can. It's not in oh, there it is, presentation mode as well. Ru, perfect.
Perfect. Okay, so thank you, Dan. Thank you all for having me. So yes, as Dan said, I am going to talk to you about workforce wellbeing in the context of the modern ward round. So what that's going to involve is a little bit about what wellbeing is, and then two key concepts really: accountability and compassion. And then I'm going to take you through three tricks that I use in terms of my own wellbeing, but also when I'm working with people on wellbeing, and how to develop a sense of self-compassion and accountability to oneself. So as Dan said, I'm a trainee in geriatric medicine, and so the ward round really is bread and butter for me. So the work that you're all doing in terms of improving ward rounds, I think is fascinating. I'm also a less than full-time trainee and currently an associate for trainee support at the East Midlands Deanery. As a health and wellness coach, I work with individuals, but also with groups looking at well-being, and that can be in a personal context or as a group, as a team context. And as Dan said, I did a lot of work on workplace wellbeing in my role as Chief Registrar at Sherwood back through 20 into 21 this year. But what that involved was looking at burnout, the causes of burnout, the organisational reasons for burnout, and more broadly developing an offer that fit the workforce for such changing and challenging times. So I'm going to throw in a quick couple of disclaimers. Through the course of this presentation, I will be posing what I've called difficult questions. They're not difficult per se, they're supposed to be probing and get you to think. I would advise writing down notes on a piece of paper if you can. At no point will I ask anyone to divulge what they've written down, but if you want to, or if you've got questions, I'm very happy for this to be interactive. At some point, it will also feel like there's a lot of silence, but that is deliberate, and it's a coaching tactic that we use sometimes as well. So the first thing I'm going to ask you to do, which is separate to the probing questions, is to think about a problem that you have at the moment that you are currently trying to solve. And that can be in the context of the modern ward round or outside of work. And then just write down a couple of key phrases or words that would sum up that problem for you, because we're going to come back to it later. So, a problem. Okay. Hold on to that. So the Royal College of Physicians very astutely have picked up what I think is the heart of the problem with ward rounds. So what you have is this highly skilled, dynamic, multidisciplinary team made up of all these wonderful individuals, all of whom have their own priorities and different agendas. And the Royal College says that this leads to frustration for staff and patients. But if I was being deliberately provocative, I would say that what it leads to is conflict. So even though we're all there trying to do the right thing for the patient and achieve the best possible outcome, all of us have different agendas. All of us have different ways of thinking about things. And that conflict and those competing priorities can make things difficult. So my first probing question for you as individuals, what are your competing priorities at the moment? What are all the different things that you are trying to balance? That can be on a ward round or in work in general, or even outside work. And for those of you who are clinical and who do ward rounds, when did you last feel that you were able to do a consistently good, if not gold standard, job on a ward round? And the unwritten question there is, what stopped you? So what is well-being? There are 4 definitions here, and you can all find these definitions simply by Googling what is well-being. And I've deliberately been vague and nondescript because the point that I'm trying to make here is that well-being is subjective. It's individual and it is impossible to pin it down with one definition. But what I've done is highlighted a few really important phrases for me. So the state of being comfortable, healthy or happy. I can think of at least 3 or 4 people who I am familiar with who have long-term chronic conditions or terminal diagnoses who we would say are not healthy, but who experience good well-being or positive well-being. And certainly as a practitioner of health and well-being and coaching, the absence of negative emotions is wholly misleading. So life and day-to-day work brings up negative emotions. The frustration that's identified right at the beginning, the conflict, the disappointment, those are negative feelings. But the point about well-being is having the tools to deal with those feelings and to turn them into constructive action. But also within that is the need for that to be sustainable. So we can't all fly high all of the time. So how do we make it so that when we are going through the low points or when something is particularly challenging, how you bring yourself out of that? And I think the last thing that I've mentioned is prosperity. So for me, I think, again, this is one of those things that's setting us up to fail. And what does prosperity mean? What does success mean? It comes back to the absence of negative emotions. It isn't necessary to have all the things that externally validate us to experience positive well-being. It's just about how we get there. Some of you might have seen this graphic before. This is something called the Wheel of Life, or dimensions of well-being. And in the practice of health and well-being coaching, or in well-being in general, what we try to do is recognise that our well-being is made up of multiple dimensions. And why is this relevant to the modern ward round, or to any ward round? There is a truth that our lives are made up of multiple moving parts all of the time, and our occupational self and the person who we are at work is just one version of us. And then there are all these other competing factors that require our attention and our energy and our input. And so it stands to reason that if something isn't going well at home, or if your child isn't doing very well at school, or if you're under financial pressure, that will impact your ability to be present at work and be contributing to your multidisciplinary team in a way that you want to, irrespective of what everybody else's expectations of you are. And so well-being really is about trying to balance all of these competing interests and to try to recognise when something isn't going very well, and if it isn't going very well, to then try to understand why not. The next step is to try to understand what you can do about it, but there's a whole separate talk in there. So another pause. And I'd just like you to consider the question, are you well today? Emotionally, mentally, physically, are you well? Have you ever come to work unwell? Whatever that means to you. And was it the right thing to do in your heart of hearts? And there isn't a right or wrong answer to that. As a workforce, increasingly we hear reports about sickness absence. And this is the last statistic that I could find on the NHS digital website. So in July this year, sickness rates were higher than the month before and higher than that time last year as well. But actually, for me, what's the crux of this is the reasons why people are reporting sickness. So anxiety, stress and depression are now the most reported reason for sickness, and that's across all of the different disciplines. But what we're saying here is that over 500,000 full-time equivalent days were lost to mental health and or wellbeing diagnoses or problems just in July 2021. So while that's staggering, the positive that I take away from that is that we're starting to recognise and talk about the impact of the work that we do on our mental and physical well-being, mental well-being, as well as our physical well-being. And that's really important. So why do those numbers matter? Why is that relevant? Well, we've talked about how the Royal College have pointed out that our competing priorities lead to these frustrations and, as I've said, conflict. But what that translates into is poorer standards of care. So errors, longer stays in hospital as communication breaks down, and potentially readmissions. And as a geriatrician, I say that quite reluctantly because we openly admit that we can't prevent all readmissions. But the bottom line is the standard of care that we deliver is affected. For me, there's another level to this, which is the individual and personal consequence on our colleagues, on us as members of the multidisciplinary team. So another pause. Who is responsible for your well-being? Do you prioritise you? Do you look to somebody else to prioritise you? Which brings us to accountability. The internet and social media are awash with pictures like this, and some people, I think, find them helpful. Certainly if you go on Twitter, you'll see the odd tweet of asking for positive messages and pictures of cats. But if you're like me, you find them a little bit cringeworthy. They don't really help that much. But the thing that I wanted to draw out of this is the word you. So you've got this. You can do this. Empowering phrases, but actually when you're feeling rubbish, when you're feeling like you can't do it, or when you haven't got the energy, it's not that helpful. So how do you become accountable for yourself in that moment? This graphic is taken from the NHS website. It's called 5 Ways to Wellbeing, and some of you might have seen it before. And if you do work in wellbeing with different employers in the NHS, you'll notice that it forms the foundation for a lot of wellbeing strategies. But what the graphic tells us is if we do these 5 things as individuals, we will feel the benefits. And I'm being deliberately harsh. But if you connect, you give, you take notice, you keep learning and you're active, you will feel better. Actually, as an individual, if I'm feeling tired, exhausted, right at the bottom of it, what this sounds like is just giving more of myself when maybe I don't have much more to give. So as a health and wellbeing coach, I 100% subscribe to the idea that I am accountable for my well-being. But sometimes what you don't need to hear is other people tell you that. And hopefully what we'll do later is explore how you can take some ownership of that. So it is on you, but it's not wholly on you. So would you know if you're experiencing burnout? Do you feel confident that you know what burnout is? Would you be able to identify and, secondly, and most importantly, address the triggers if you're experiencing burnout? The World Health Organization is very clear that burnout is not a medical diagnosis. It is an occupational phenomenon that arises as a result of chronic, unresolved workplace stress. And that's really important. The individual is experiencing a constellation of symptoms, signs, whatever you want to call them, as a result of the environment that they are being forced to work in or put to work in. So the other side of accountability is our systems and our employers and our organisations. And if you think about that in the context of the multidisciplinary team in the modern ward round, what you have is a huge array of different systems, different teams, different protocols, all trying to come together. One of the things that I don't like about this graphic is how corporate it is. So for me, it's very strategic based, know your data, communicate it, engage, output. But actually, it's what we're trying to do to improve. And so what you end up with really is that your well-being is the sum of the organizational factors that you're exposed to, the individual factors that are unique to you, and then the ability to access support when you need it. So moving on to compassion. What is it? Do you feel that you know? Do you feel compassion? If you feel it, who do you feel it for? The Compassionate Mind Foundation is run by a professor of psychology called Paul Gilbert, who does a lot of work on compassion-focused therapy with people who experience anxiety and depression. But I particularly like how the Compassionate Mind Foundation described compassion. I didn't really start to learn about compassion until the second wave of COVID in the context of some of the work that we were doing. But so much about this simple sentence speaks to me. A sensitivity to, or I read that as an awareness of suffering in self and others, but with a willingness and a desire to try and fix it. There's so much packed into that one sentence, but I'll just draw your attention to the fact that it is the self-awareness of suffering that comes first, and there is good reason for that. And indeed, compassion is one of the core values of our NHS constitution. And what I like about this is that it doesn't specify whether it's patients, colleagues, or whoever. It is each person, an awareness of each person's pain, distress, anxiety, or need. And there is increasing evidence that compassion has an important role to play in healing, rather than it just being a characteristic that we should demonstrate because it's the right thing to do. So the earliest science around this comes from the work on attachment theory by John Bowlby, who was a British psychologist. And basically what he did was look at the distress caused to infants when they were separated from their primary caregiver, predominantly mothers, and how that distress then impacted their ability to connect with and feel for people later in life. And so the lack of compassion they experienced by being separated from their carer translated into their ability to feel or not compassion later in life. But even so, in modern studies, what we're seeing is that compassion-centered care improves our relationships with patients and is associated with longevity and better outcomes. And obviously, compassion-centered care, very difficult to study. It's very difficult to set up a randomized controlled trial, but the qualitative evidence is positive. And if we go back to Paul Gilbert and the Compassionate Mind Foundation, their argument is that we experience emotions and our emotional reactions in 3 systems, and that our compassion is hardwired into that. The drive system, the threat system, and the soothing system. And we know that if we activate our threat system, what that causes is more withdrawn and competitive behaviours, a sense of me, I need to look after me, short-term focus, how can I control this situation so that I'm okay? Whereas if we put ourselves in a system and a situation that activates our soothing system, that allows us to grow, that allows us to connect with other people, what we end up doing is becoming more we-focused, sharing, collaborating, exactly the things that we're trying to do. The problem that we have is once the threat system is activated, it tends to circulate and become self-fulfilling, and then breaking that cycle is very hard. But the consequence is that our compassion isn't boundless. I'm sure that many of you will have come across the phrase compassion fatigue. But what is compassion fatigue? I mean, it basically is what it says on the tin. You run out of compassion. But in order to do that, you have to be exposed to two things: secondary trauma and cumulative burnout. We are all exposed to secondary trauma through the work that we do, especially for those who are directly clinically facing. For example, you may witness the suffering of your patient. If I think about this in a personal context, COVID was very difficult, seeing patients experience an illness that they had very little control over, and also being separated from their loved ones during that time and the distress that caused to them. So that secondary trauma, that distress that I'm witnessing, if you then add to that cumulative burnout, which is simply having too much work to do and not enough of the resources you need to do it, you can see very quickly that that becomes an unsustainable situation, and your ability to feel compassion in that, to be aware of the suffering and then to want to try and fix it, can be exhausted. And the problem with this is multifocal. You then have an individual impact where people who care are being put in a situation where they're struggling to care or struggling to deliver a standard of care that is in line with their values, and then the actual impact on standards of care and patient experiences and outcomes. But we also know from work done by another psychologist called Kristin Neff, who's an American psychologist, that self-compassion and developing self-compassion is associated with many positive attributes. And some of these might seem a little bit woolly, for example, like happiness, optimism. But if you think about things like being conscientious, curious, wanting to improve, wisdom and learning from your experiences, all of those are fundamental to our ability to contribute to a team and a multidisciplinary team in a constructive way. But inevitably, what we come back to is this concept that there are organizational factors. So there is having the resources to do what we need to do. There are individual factors, our exposure to the distress of other people, and then the support that we have access to, the importance of how that must be visible and accessible. And why this is relevant to modern ward rounds is, although I've talked about the multidisciplinary team, really what the underpinning method is improvement methodology. And if we think about what improvement is in terms of methodology, and I've chosen deliberately the PDSA methodology here, although I know that there are others. We take a problem, we plan, we come up with a solution, we try to implement it, we study it, and then we act on the consequences or the outcomes of it. So what is that if it isn't accountability and action? And that consequential step up. But that on its own is tiring and it's energy consuming. But in the same way, we know from the work of Kristin Neff that improvement must demand self-compassion, curiosity, a willingness to learn, positivity, optimism. I would argue are very important for a willingness to improve. So how can we be accountable to ourselves and develop our self-compassion? So my first trick is to focus on control. What you'll see there are 3 concentric purple circles, and hopefully some of you will recognise this from Stephen Covey's book, The 7 Habits of Highly Influential People. The idea is that right in the middle, right there in the centre, is your circle of control. And in there are all of the things that you have control over. Outside that, you have a circle of influence that you might have some influence over. And then outside that, you've got a circle of concern, the things that you have no control over. For example, if you put it in the context of COVID, at the moment, we have no control over what the next edict is coming from the central government. What can we control though? We can wear our masks, we can get boosters, we can influence others to have boosters. But what you see by focusing on your circle of control, you start to let go of the things that you have no control over. Very empowering. It's not easy, but it is useful. Trick 2, and it sounds very obvious, but get to know yourself. And that can be in the context of your well-being as a whole, or you as a person at work, or all of them. The wheel of life that you see in front of you is a tool that we use in health and well-being coaching. And what we try to do is explore the different dimensions of it and map out where people are in their lives at a given point in time. And it can be that you choose to focus on one thing because it's not going very well. But the other thing that I would suggest is that knowing what's working for you at a given point in time is also really important, because what are you doing to keep that going, and how can you keep nurturing that? Embedded in this is then knowing how you react to challenge. So if you face a challenge, or if something isn't going well, do you respond with a positive or a healthy behaviour? Do you go for a run? Do you go to bed earlier? Do you talk to a friend? Or is your response a little less healthy? Do you open a bottle of wine? Do you turn to comfort foods? Do you retreat into yourself? Get to know yourself. And again, it's very flippant. It sounds very flippant, and as if, you know, talking to adults, we should all know ourselves by now. But actually, this can lead to very confronting conversations and generate solutions to problems. And then the next trick is to ask yourself the right questions. And I thought very carefully about the phrasing of that, the right questions. In coaching, we would call that powerful questions. And there's something here about having a mindset. And so what I'd like you to do now is go back to that problem that we wrote down right at the beginning. So what problem are you trying to solve at this point in time, at the moment? And I will just take you through a very brief coaching exercise based around asking difficult or the right questions. So you've got your problem. Let's turn it into a goal. If you were to fix that problem, what would that success look like to you? What would you like to happen that is not happening right now? And so what's the reality? What are the current barriers that you face in relation to your problem? What's in your way? What or who is holding you back? What options do you have? Who can help you with those barriers? What else could you do? And now you've identified your options. What will you do next? And on a scale of 1 to 10, how committed are you to moving that forward? So that's a hypersonic coaching exercise, but just to try to frame the importance of identifying a problem and then asking the right questions around it. So I've talked for almost half an hour now, so just to summarise, core to this are accountability and self-compassion. When you are working as a multidisciplinary, dynamic, highly functioning, very skilled team, people being accountable for themselves but also for others is crucial to that. But embedded in that is our ability to be aware of other people and ourselves and then react to that. And if we are to see sustainable improvement, not just in the modern ward round context, but in any context, what we need to do is put people and the people who are delivering that at the heart of what we're trying to do. And I hope that I've given you a couple of tools that I'm very happy to explore if anyone's interested for developing some of that personal accountability and self-compassion. So I will stop there.